7 common medications that can damage your kidneys. A 2024 medical study has uncovered a shocking truth. 1 in 5 cases of acute kidney failure in hospitals is directly linked to medications. Even more alarming, kidney disease now costs over $42 billion annually, with millions unaware that the very pills they trust could be putting them at risk. Your kidneys silently filter 180 liters, nearly 50 gallons of blood every day, removing toxins, regulating blood pressure, and balancing critical minerals. But unlike the liver, which can regenerate, once kidney function declines, it may never recover. Recent studies confirm that even common medications, painkillers, antibiotics, blood pressure drugs, and acid reflux medications, can trigger irreversible kidney damage without warning. The real danger? No early symptoms. By the time signs like fatigue, swelling, or reduced urination appear, up to 90% of kidney function may already be lost. Some of the worst offenders include NSAIDs, certain antibiotics, diuretics, and contrast dyes used in medical scans, all of which have been directly linked to chronic kidney disease and kidney failure. This information could save lives. Like, share, and subscribe so more people can protect their health. And don't forget to share this with anyone who takes medication, because prevention starts with awareness. Your kidneys, the body's most sophisticated filtering system, and why medications are silently destroying it. Your kidneys do far more than just remove waste. They perform 7 critical functions essential for survival. These powerful organs regulate blood pressure, balance electrolytes, produce red blood cells, control pH levels, strengthen bones, detoxify the body, and maintain fluid balance. Yet, they're also among the most vulnerable to medication damage. Every day, your kidneys filter 180 liters of blood, removing toxins and excess fluids. But when certain medications enter your system, they can trigger a devastating chain reaction, inflaming kidney tissues, restricting blood flow, and impairing filtration. Over time, this silent damage leads to chronic kidney disease, dialysis, or even failure. New 2024 imaging technology has provided shocking insights into how medication-induced kidney damage progresses. MRI scans now reveal microscopic scarring, long before symptoms appear, proving that even seemingly harmless drugs can cause permanent, irreversible harm. So, how can you protect your kidneys? Let's dive in. 1. NSAIDs, the painkillers that could shut down your kidneys. A 2023 Harvard study has confirmed a chilling reality. NSAIDs, ibuprofen, naproxen, aspirin, are a leading cause of kidney failure. Even short-term use can silently trigger irreversible damage. Research shows that taking NSAIDs for 72 hours or more can drastically reduce kidney function, especially in people with high blood pressure, diabetes, or dehydration. The worst part? There are no warning signs. By the time symptoms appear, kidney damage may already be permanent. These painkillers work by blocking prostaglandins, chemicals that reduce pain and inflammation. But prostaglandins also keep blood flowing to your kidneys. When they're blocked, blood supply drops. Kidney tissues suffocate, cells die, and microscopic scarring spreads. Over time, filtration weakens, waste builds up, and the risk of chronic kidney disease, dialysis, or total failure skyrockets. The danger worsens when NSAIDs are combined with ACE inhibitors or diuretics, common blood pressure medications. This triple drug combination is known as the kidney killer combo, significantly increasing the risk of kidney shutdown. Even if you feel fine, the damage could already be happening. If you rely on NSAIDs, rethink your options. Acetaminophen Tylenol is a safer alternative for most people. If NSAIDs are necessary, limit use, stay hydrated, and never exceed 3 consecutive days. Because once your kidneys fail, there's no going back. 2. Antibiotics, when the cure becomes the problem. A Johns Hopkins study has confirmed a disturbing truth. Antibiotics are now a leading cause of drug-induced kidney failure. These medications, designed to fight infections, can silently damage the kidneys beyond repair if misused or taken for prolonged periods. The kidneys play a critical role in filtering antibiotics from the bloodstream. But some antibiotic classes are highly nephrotoxic, meaning they attack kidney tissues directly. Research identifies 5 high-risk classes: aminoglycosides, gentamicin, tobramycin, fluoroquinolones, ciprofloxacin, levofloxacin, sulfonamides, Bactrim, beta-lactams, penicillins, cephalosporins, and vancomycin. These drugs can trigger inflammation, reduce blood flow, and cause toxic buildup in kidney cells, leading to acute kidney injury, AKI, sometimes within days of starting treatment. The risk isn't just about which antibiotic you take, it's about how long, how much, and what other medications you're using. Combining nephrotoxic antibiotics with NSAIDs or diuretics amplifies the damage. Those most at risk include older adults, diabetics, and individuals with pre-existing kidney conditions. But here's the problem. Kidney damage from antibiotics is often silent. No pain, no early symptoms. By the time fatigue, swelling, or decreased urination appear, permanent scarring may have already occurred. Doctors now emphasize strict monitoring, protocols including regular blood tests to check creatinine levels. Yet many patients aren't warned about these risks. If you're prescribed antibiotics, ask if kidney function will be monitored, stay hydrated, and report any unusual symptoms immediately. Because while antibiotics can save lives, they can also cost you your kidneys, without warning. 3. Blood pressure medications, the double-edged sword. A 2024 meta-analysis has revealed a troubling paradox. Some blood pressure medications meant to protect your heart could be silently damaging your kidneys. According to Mayo Clinic findings, ACE inhibitors like lisinopril, enalapril, and ARBs like losartan, valsartan, widely prescribed to control hypertension, can reduce kidney function over time, particularly in vulnerable individuals. The kidneys and blood pressure share a delicate relationship. The kidneys regulate blood pressure by filtering excess fluids and balancing electrolytes. But when blood pressure drops too low due to medication, kidney filtration slows, reducing oxygen supply and triggering tissue damage. This paradox means that while these medications help prevent heart disease, they can sometimes impair kidney function, especially in those with pre-existing kidney disease, diabetes, or dehydration. A 2024 meta-analysis identified key risk factors. Elderly patients, diabetics, and individuals taking NSAIDs or diuretics alongside blood pressure meds. These combinations can amplify the risk of acute kidney injury, AKI, by further restricting blood flow to the kidneys. To prevent silent damage, doctors now emphasize evidence-based monitoring protocols. Patients on ACE inhibitors or ARBs should undergo regular kidney function tests, including serum creatinine and glomerular filtration rate, GFR monitoring. Warning signs like fatigue, swelling, and decreased urination should never be ignored. If you're on blood pressure medication, ask your doctor about kidney function tests. These drugs save lives, but without proper monitoring, they could also be silently pushing your kidneys toward failure. 4. Diuretics, when water pills become kidney pills. A Cleveland Clinic study has confirmed a hidden risk. Diuretics, commonly known as water pills, can quietly harm kidney function when misused. These medications, prescribed for high blood pressure and fluid retention, work by forcing the kidneys to expel excess water and sodium. But when overused, they can trigger a dangerous cycle of dehydration and kidney stress. The kidneys rely on a delicate balance of fluids to function. Diuretics strip the body of water rapidly, sometimes too aggressively, leading to reduced blood flow to the kidneys. When this happens, the kidneys struggle to filter waste, cells become damaged, and kidney function declines. This dehydration damage cycle is especially dangerous for older adults, heart failure patients, and those with pre-existing kidney disease. Another major risk is electrolyte imbalance. Diuretics flush out potassium, sodium, and magnesium, minerals crucial for maintaining kidney and heart function. Severe imbalances can lead to muscle weakness, irregular heartbeats, and acute kidney injury, AKI. To minimize kidney harm, new 2024 guidelines emphasize careful dosing and regular monitoring. Doctors now recommend routine blood tests to check kidney function, hydration levels, and electrolyte balance for patients on long-term diuretic therapy. Symptoms like dizziness, extreme thirst, confusion, or reduced urination are warning signs of potential kidney stress. Diuretics are life-saving when used correctly, but without proper monitoring and hydration, they can push the kidneys toward failure. Always consult your doctor to ensure safe dosing and kidney protection. Contrast dyes. the imaging risk. A 2024 radiology study has confirmed a serious but often overlooked threat. Contrast dyes used in CT scans, MRIs, and angiograms can trigger acute kidney injury, AKI, sometimes leading to permanent damage. These dyes, injected to enhance imaging, can be toxic to kidney tissues, especially in older adults, diabetics, and those with pre-existing kidney disease. The danger window is 48 hours. Within this time frame, contrast dyes can reduce blood flow to the kidneys, cause oxidative stress, and inflame kidney tissues. In severe cases, this leads to contrast-induced nephropathy, CIN, a rapid decline in kidney function. Recent studies estimate that 10–15% of hospitalized AKI cases are linked to contrast dyes, making them a significant but underreported risk. To reduce harm, new protective protocols emphasize prehydration with IV fluids before and after contrast, exposure, using the lowest dye dose possible, and monitoring kidney function post-procedure. Patients at high risk are now advised to undergo blood tests, serum creatinine and GFR, before imaging to assess kidney health. Safer alternatives are also emerging. In some cases, non-contrast MRIs, ultrasounds, or alternative imaging agents can provide diagnostic accuracy without the kidney risks. If a contrast scan is necessary, ask your doctor about protective strategies to safeguard kidney function. Contrast dyes are essential for medical imaging, but without proper precautions, they can cause silent yet severe kidney damage. Understanding the risks can be the difference between life-saving diagnostics and life-altering kidney failure. 6. Heartburn medications, the silent threat to your kidneys. A 10-year study has revealed a shocking truth. Proton pump inhibitors, PPIs, commonly used for acid reflux and heartburn, significantly increase the risk of chronic kidney disease, CKD. Medications like omeprazole, pantoprazole, and esomeprazole are among the most widely prescribed drugs worldwide, but long-term use may come at a devastating cost. Researchers found that regular PPI users were up to 50% more likely to develop CKD compared to those who used other acid reducers. Worse, many patients showed no early symptoms of kidney decline, making the damage silent and progressive. The danger lies in how PPIs disrupt kidney function over time. These drugs reduce stomach acid, but they also interfere with magnesium absorption, an essential mineral for kidney health. Low magnesium levels contribute to inflammation, oxidative stress, and gradual scarring of kidney tissues. Over time, this scarring leads to impaired filtration, waste buildup, and eventual kidney failure. Certain groups are at higher risk: elderly, patients, those with diabetes, high blood pressure, or pre-existing kidney conditions. The risk escalates when PPIs are used for longer than necessary or combined with NSAIDs or diuretics. In response, gastroenterology experts now recommend limiting PPI use to the shortest duration necessary. Safer alternatives like H2 blockers, famotidine, dietary modifications, and lifestyle changes are now emphasized for long-term acid reflux management. If you've been on PPIs for months or years, talk to your doctor about kidney function testing and safer options. These medications offer relief, but prolonged use could cost you your kidney health, without warning. Over-the-counter combinations, the dangerous mix that could destroy your kidneys. A recent FDA warning has sounded the alarm on a hidden danger. Common over-the-counter, OTC medications, are silently damaging kidneys when combined. Many people unknowingly take multiple drugs with overlapping ingredients, leading to toxic buildup, reduced kidney function, and long-term scarring. One of the biggest threats? Hidden NSAID combinations. Many cold, flu, and pain relief medications contain ibuprofen, naproxen, or aspirin, often mixed with other drugs. Without realizing it, people take multiple NSAID-containing products in a single day, exceeding safe limits. Research confirms that repeated high doses significantly increase the risk of acute kidney injury, AKI, especially in dehydrated individuals. The problem doesn't stop there. Cumulative damage builds over time. Combining NSAIDs with acetaminophen, diuretics, or blood pressure medications creates a toxic cocktail that stresses kidney filtration units. The risk is even greater for older adults, diabetics, and those with high blood pressure whose kidneys are already vulnerable. To prevent silent kidney damage, new guidelines emphasize safer alternatives and better awareness. Doctors now recommend limiting NSAID use, staying hydrated, and carefully reading medication labels to avoid unintentional overdoses. Safer pain relief options include acetaminophen, Tylenol in moderate doses, heat therapy, and non-drug approaches like stretching and physiotherapy. Before reaching for another OTC pill, check the label, understand the risks, and avoid dangerous combinations. Your kidneys work tirelessly to filter toxins, but once they're damaged, there's no easy fix. The 5-step kidney protection system. With medication-induced kidney damage becoming increasingly common, healthcare experts now emphasize proactive monitoring and early intervention as the best defense. The kidneys often sustain damage silently, without obvious symptoms until function is severely compromised. To counter this, researchers have developed a 5-step protection system based on clinical evidence. Routine blood and urine tests. Regularly monitor creatinine levels, glomerular filtration rate, GFR, and urine protein levels every 3 through 6 months, especially if taking high-risk medications. Early detection of elevated creatinine or proteinuria can identify kidney stress before it becomes irreversible. Blood pressure management. Uncontrolled hypertension is a major contributor to kidney disease. Keeping blood pressure below 130/80 mmHg significantly reduces stress on the kidneys. Blood pressure medication should be carefully adjusted to avoid excessive drops that could impair kidney filtration. Medication risk assessment. Many common medications, including NSAIDs, diuretics, antibiotics, and acid reflux drugs, can harm the kidneys over time. Periodic medication reviews with a doctor or pharmacist help identify nephrotoxic drug interactions and safer alternatives. Hydration and electrolyte balance. Dehydration and imbalanced electrolytes can intensify medication-induced kidney damage. Drinking adequate water and avoiding excessive sodium, processed foods, and high-protein diets reduces the strain on kidney function. Personalized monitoring for high-risk individuals. Those with diabetes, high blood pressure, heart disease, or pre-existing kidney conditions should follow strict kidney function tracking protocols and undergo frequent testing to detect early-stage dysfunction. Smart tracking and when to seek help. Technology is revolutionizing kidney health monitoring. Digital health tools and AI-driven risk assessment algorithms now provide real-time tracking and early warnings. Apps like MyKidneyCare and Renal Tracker allow users to log symptoms, track lab results, and receive AI-driven kidney health insights. These tools help identify subtle changes in kidney function before they become severe. New risk assessment algorithms analyze multiple health parameters, helping doctors detect early-stage kidney dysfunction and tailor treatment plans accordingly. Telemedicine consultations now allow high-risk patients to receive ongoing monitoring and personalized medication adjustments. It's crucial to recognize warning signs early. If you experience persistent swelling, decreased urination, chronic fatigue, unexplained nausea, or dizziness, seek immediate medical attention. These could be signs of silent kidney stress that, if ignored, may progress to permanent kidney failure. For individuals on NSAIDs, diuretics, antibiotics, or blood pressure medications, scheduled kidney function tests should be a mandatory part of routine healthcare. Kidney damage is often irreversible but entirely preventable. Following these evidence-based monitoring strategies can mean the difference between lifelong kidney health and long-term dialysis or transplant. Action plan and resources. Your blueprint for kidney protection. Kidney damage from medications is often silent but preventable. The key is awareness, proactive monitoring, and informed decision-making. This action plan serves as a quick reference guide to help you safeguard your kidney health and take immediate action when necessary. Quick reference guide for medication safety, NSAIDs, ibuprofen, naproxen, aspirin. Limit use to short-term relief, max 3 days. Avoid in dehydration, kidney disease, or when taking diuretics. Antibiotics, aminoglycosides, fluoroquinolones, sulfonamides. Ask your doctor for kidney-safe alternatives if prescribed long-term. Monitor kidney function while on these medications. Blood pressure medications, ACE inhibitors, ARBs, diuretics. Check kidney function regularly especially when using multiple blood pressure drugs. Avoid the triple threat of NSAIDs plus diuretics plus ACE inhibitors. Heartburn medications, PPIs like omeprazole, pantoprazole. Limit use and consider H2 blockers, famotidine, or lifestyle modifications for long-term acid control. Contrast dyes used in CT scans, MRIs, angiograms. If imaging is needed, ask for non-contrast alternatives or take protective measures like prehydration,